Good evening. Myself Neha Kumari, physiotherapist at PRS Neurosciences Research and Mechatronics Private Limited. So in the series of spinal cord injury, I will be discussing about pain in spinal cord injury. Loss of functionality is the most common thing which we see in spinal cord injury patients. They're usually wheelchair bound or some are bedridden. But in these cases also, pain is also one of the most important factors. Pain can lead to such an extent that it can hamper their modified ADLs as well. Now what is this pain and why does this pain happen? Basically, pain can be either central in nature, which is either coming from your higher centers or from the peripheral. Not all spinal cord injury, as we all know, can be complete. Some of them are incomplete as well. So in these incomplete spinal cord injuries, some of the remaining nerves, they become hyperexcitable, and then they will keep on sending signals by themselves without any painful stimuli given to the body. So that can also lead to pain that can also lead to a patient perceiving the pain. Now you might think that what is this pain and how will I come to know exactly whether I'm having a pain, whether the patient is having a pain or is it psychological. So how do you differentiate it? There are various classifications. As if you meet the doctors, they will say it is of neuropathic in nature, nociceptive in nature or psychological in nature. When the patient goes through a lot, they are into distress. Psychologically, they start thinking that they are having a pain. So such type of pain are not actually functional or structural in nature. This comes from more the psychological aspect. The other neuropathic pain which I mentioned, patients presents with your throbbing like of a pain, sharp shooting like of a pain or a tingling type of a pain, then it will be your mostly the neuropathic pain. Neuropathic pain in the sense coming from your higher centers, when your nerve cells gets hyperexcitable and they start sending signals by themselves. So that is one type of pain which they might feel. The other will be something more of when during the rehabilitation you are working a lot, you are doing a lot of strengthening exercises for the remaining group of muscles. So at times because of your muscle overuse, you might also have a pain which is more like a spasm type. Post muscle spasm or post muscle overuse, you will get a pain or a patient will get a pain. Next can be which also mentioned as a nociceptive pain. Nociceptive pain can, again, one which I already mentioned, because of the muscle overuse. Second can be because of the visceral. Visceral, when we say, it is nothing but your abdominal pains or your any viscera which causes any discomfort. The others, which is the most important aspect, something called as a autonomic dysreflexia. In autonomic dysreflexia, the patient will start having pounding headache. That is also one type of a pain which they will have, followed by your fluctuation in your blood pressure, fluctuation in your heart rate, flushing type of a sensation, too much of sweating they will have. So that is one of the dangerous aspects. So at that time we need to be alert and attentive enough that those are the red flags type of a pain which they get. So pounding headache, suddenly change in heart rate post that, sudden change in BP immediate post headache is one of the dangerous type of a pain. Next, now which we have already discussed about what are the type of pains. So let us summarize. Nothing but neuropathic pain will have more like a sharp shooting type of a sensation, tingling or a burning or a squeezing type of sensation, whereas this nociceptive or the peripheral side will have something like a dull aching type or spasmodic pain. The other which I mentioned about the autonomic dysreflexia, it will be more towards your headache, and it is also a more alarming signs in spinal cord injury patients. It is also a life-threatening situations, should be immediate medical attention should be given. Next is now let me give you a gist about why do they go through, they have so much of pain. So not in very simple terms, we have, our body has many small nerve cells which are ideally responsible to receive painful stimuli from the periphery. But when any injury to the spine happens, these cells, they will become hyperactive, and invariably they will start sending signals by themselves even if the body is not receiving any stimuli, and that is why they have pain. Now we have discussed everything about what is the pain in spinal cord injury, why do patients have pain in spinal cord injury, what are the different types of pain which patients usually get, and what is the most dangerous type of a pain. Now coming to the treatment aspects. As we all know, there is a medical management, there is a other rehab management, there is a surgical management. So coming to the medical management, you will have the pharmaceutical interventions or the medicines given by your consultants to take care in the form of, say it, any pain relieving medications. And as per a therapist, as per a physiotherapist, how do we deal with such pain? We do a detailed assessment, which is very important to differentiate what type of pain the patient is having, whether it is purely psychological, whether it is structural at the muscular level, whether it is visceral at our other visceras, or the system, or other say abdomen or heart, anywhere, or whether it is from the higher centers. So we have our protocol based uh, assessment tool and assessment kit to assess. Following assessment, coming to the therapy wise, we decide what type of a therapy the patient needs. So if the patient is thinking about it, so more of a psychological aspect, we go through the cognitive therapy assessment or cognitive retraining, counseling, cognitive restructuring, cognitive behavioral therapies. There are many therapies which they have. And when, if it is actually a structural or a, say, musculoskeletal type of a pain, we follow our pain management protocols, which includes pain modalities, releasing if they have any spasm, so symptomatic rehab strategies to work on them. Next is coming to if they have any other type. So ideally transcutaneous electrical nerve stimulation is one of the the evidence have suggested that it is helpful in relieving pain. And next is the most important aspect is um, that how do we differentiate as a therapist, how do we differentiate that, whether, or even as a normal person, how do we differentiate that what type of a pain a patient is having. Usually neuropathic pain or a pain coming from a higher centers, they increase or over the time, or they gradually keep on increasing, they are more chronic in nature. So within a long, and it's sustained for a long period of time, whether it is irrespective of the nociceptive pain or pain coming from a muscular origin, it decreases over time if in such cases if appropriate treatment is taken. Next is your surgical management. Surgical management, what do we have? There are different types of surgical interventions which are done. One is called as dorsal column stimulator. So this dorsal column stimulator is nothing but an implantation of a stimulator done at the spinal canal level near the spinal cord, which keeps on giving a low intensity high frequency current to block this pain pathway. That is one of it. Second is your pumps, intrathecal pumps. So intrathecal morphine pumps are the most commonly used implantation done to treat. These pumps are usually implanted within the patient, and it is used to relieve your spasmodic type of a pain. Coming to the other surgical procedures, we have something called as a rhizotomy. Rhizotomy is nothing but your what they do basically is they denervate the nerve cells which is causing pain. In the sense, they will just the medical team, they remove the problem which is causing the pain. So if any nerve cells are causing pain to the patient, they are removed either by two methods, either something called as by hemodenervation, that is your chemical method, or by thermal denervation, that is your current method. So through heat, they will just damage that nerve cell which is causing pain in the system. So these are your surgical interventions, your conservative interventions, which will include your psychological aspect as well as medical as well as the rehab aspect.